If you're trying to taper off of a psychiatric medication and experiencing severe withdrawal symptoms, is it helpful to start another medication to address those symptoms? My name is Dr. Ruth Dotton. I'm a board certified adult psychiatrist, and I talk a lot on this app about the importance of providing full informed consent when starting a psychiatric medication, as well as concepts of safety prescribing. And this is a question or concern that has come up frequently in my own practice as well as on this app. And there's the ideal world situation, and then there's reality. So ideally, you would not add another psychiatric medication that could further interfere with the brain chemistry and make the taper more complex. So you would either slow the taper, hold the taper where you're at until those symptoms have gone away, or potentially, if it's really severe, go back up to the prior tolerated dose. So this is kind of ideal practice, right? Ideal world scenario. But there are cases in which I would consider introducing another agent. So of course, if we're doing a cross taper rather than a complete taper off of psychiatric medications and the person is interested in or open to starting a different antidepressant, then I might consider starting another agent, right? If we're going from one SSRI to another, or if we're trying to transition from an SSRI to something like Wellbutrin that doesn't affect serotonin, but affects norepinephrine and dopamine. If, however, the goal is to completely taper off of psychiatric medications, then I'm going to recommend one, low-risk supplements. So potentially things like an omega-3 supplement or magnesium glycinate or melatonin that are not going to be having as direct of an impact on the neurotransmitters that are available. If adjusting the rate of taper and those supplements are not enough to make the withdrawal symptoms tolerable for the person, then I might consider something that they could take as needed for symptoms that they're experiencing, like insomnia or anxiety or panic attacks, with the goal being that this could be something they just take occasionally rather than every day, so that they're not just developing dependence on a different psychiatric medication. And ideally, I'm going to choose things that don't work through the same mechanism as their medication, so avoiding serotonin as much as possible. And of course, there are going to be cases that we start out with the goal being to completely taper off, and the patient changes their mind and they want to take something. They just want to take something different that might work better. And so I think it's always important to be willing to reassess the situation and the risks versus benefits for that individual, and to let the patient lead the way in terms of the priority of the taper. What about you? Have you had experiences where you've added on another medication during a taper that's been helpful? Or maybe you've tried another medication to help the taper and it's just made it so much worse. I would love to learn more about this from you all, so please share in the comments below. Wishing you all good mental health today, and I'll see you in the next one.